Hello, good afternoon, it's Martin Cassidy here. Hi, thank you for joining this webinar, and hopefully with what I share with you this afternoon, you'll see how we've actually helped to make data more meaningful and to present it in a powerful way that actually does support CCGs in terms of prioritization of cardiovascular disease and other areas, and actually helps them to see the, I suppose really the wood for the trees in terms of the amount of data that is out there related to CCG performance. So if we move on to the next slide. So I suppose I have to start with a visualization. So main thing on this slide is really 90% of all the information that comes to the brain is visual, and therefore it's a real it's a real lead-in to sort of say, well, that's why we should be considering using data visualization. And also the human brain processes images 3 times faster than text. So anybody who's worked in a clinical network, clinical commissioning group, right care, the extent of the data that actually that people are having to deal with by actually having it presented in a pictorial way actually will help with understanding that. So next slide. So, and also the reason for using infographics is, or infographics or data visualization, I'll use the 2 terms interchangeably, although sort of the purists would say not to do that. But it's about actually engaging people. It's about actually presenting data in an understandable way. Our aim is to try and get data presented on 1 page, if we can, to actually have it so that the data is unforgettable, so that people don't, people will see the key data within that very easily, and also that it's shareable. So it's information in terms of infographics. They're prolific in terms of their use on web pages and on the internet. So it's actually sort of saying, well, why aren't we using that as a method within the health service? So, and then next slide. So I was actually really surprised to realize that actually infographics and data visualization goes back to 1854. So, and may even before then. So the London Cholera Map was a very brilliant, well, it was a brilliant example of how actually by mapping data in terms of use of water pumps was actually able to identify the cause of the cholera outbreak in London. And next slide, please. So, and 1 year later, we've got the Crimea War. So Florence Nightingale, actually, you wouldn't believe that she was a proponent of data visualization, but actually the blue-gray area on this, I would say quite a sophisticated diagram, actually denotes the people who died from preventable disease, and that's why then there was a focus on improving sanitation and care within, war fields after that. So next slide, please. So this is so the Guardian are actually probably one of the papers who are sort of key proponents of using data through data visualization to make, to present it. And actually I attended a number of years ago a data visualization course run by the Guardian, and this is an example of one slide, one visualization, which is, what are the causes of death from the different diseases and other causes, and actually it's such a brilliant way of presenting a lot of information very simply on 1 page. Next slide, please. This is the first attempt that we had in terms of doing data visualization, which is actually, I think it's now 4 years old. And we wanted to make the case within clinical commissioning groups as to why they should prioritize atrial fibrillation. So on this slide, we've got a slide which shows those are diagnosed with AF. The number of those, sorry, undiagnosed with AF, the number who are undiagnosed, the number of those who would expect to have a stroke, and the number of people who die due to a stroke, and then also highlighting those who are at the bottom, those who are not on anticoagulation, how many of those would have a stroke each year, and how many would expect to die each year, and then also highlighting hospital admission costs. And if you go on to the next slide, please. This is where we're comparing at the top the current management of atrial fibrillation against the optimum management. So if you've diagnosed all of the patients who've got AF, you appropriately risk score them, and then you actually put them on the appropriate anticoagulation, then actually you could treble the number of strokes and deaths that actually prevent, as well as the hospital admission costs avoided through optimum management. And actually this slide was significantly powerful when commissioning managers and clinicians were taking this through their clinical boards to get the CCGs to prioritize improvement work on AF. And actually from where we started 4 years ago, the majority of the CCGs in East Midlands are actually at the top end in terms of the proportion of patients with anticoagulation, with AF who are on anticoagulation. So we've got 3 CCGs in the top 10, 7 in the top 20 nationally of all the CCGs through, and it's through aspects such as the infographics which have influenced CCGs prioritising that as an area to focus on. Next slide, please. So I think this is a brilliant quote, which so the greatest value of a picture is when it forces us to notice what we never expected to see. And actually, that's something that within the data that we have presented, it's presenting information in a simple way that actually people actually see things that they didn't realize exist, and actually it identifies variation and areas of gaps in care which they didn't realize were there, even though that data is already within their hands. So next slide, please. So, and this is my favorite data visualization that I've come across. It's actually showing the number of casualties from conflicts in the world. So the 2 big poppies, the one on the left is the First World War, and the one on the right, and some following on from that is the Second World War. And the bend of the flower actually denotes the length of time that that conflict went on for. And so in the top right-hand side, you see the Israel-Palestine conflict. So it goes from the middle right to current days. And next slide, please. You can just see in terms of, so the actual size of the poppy denotes the number of deaths that actually occurred as well. So next slide, please. So this is where our current atrial fibrillation slide set, which presents data as of March 2016 for CCGs. So this is trying to bring it into all of the key proponent aspects of managing AF and treatment into one slide. That's so one slide fits all for a CCG. And next slide. And again, this is another version of the current and optimum management slide that we previously did 4 years ago. So, and as you can see, the gaps between preventive strokes have actually started. So current management and optimum management started to reduce. It isn't as significant in terms of proportions because of the work that CCGs have done previously, but still identifying that there's a lot more to be done. So next slide. So what I want to just share with you, and actually if I'd known right care were going to be on here, I would have put right care on as well. So if you I did a presentation on data visualization to the UK Renal Registry, and they presented and released a report that day, which was 362 pages. Cardiovascular intelligence pack produced by Public Health England is 90 pages for each CCG, and if you look at Right Care packs, they're somewhere near 80-90 pages as well. So actually, the challenge is really how can people in busy jobs actually make sense of all that data, and we actually managed to get the key proponent aspects of the data for the cardiovascular intelligence pack on one page. So if you go to the next slide. Actually, the next slide is, sorry, this is, so we've also, so in terms of the renal registry report, we've actually produced this chronic kidney disease infographic, again trying to bring together key bits of data in terms of where CCGs are at in terms of management, diagnosis and management of chronic kidney disease. Next slide, please. This was the first version of the cardiovascular disease prevention infographic that we produced. So as I said, the intelligence pack produced by Cardiovascular Intelligence Network was 96 pages. This got some of the key bits of data in terms of the areas that we wanted CCGs to focus on down to one page. Next slide, please. This is the updated version of the infographic on cardiovascular disease prevention. So each year we add new new elements to it. So within this we've got familial hypercholesterolaemia in this, down near the bottom center of the page, and also further stuff in terms of local smoking cessation provision and uptake. Next slide, please. So I just want to show that we've also done work in other areas. So this is an example of an infographic that we've used on COPD. So highlighting variation in terms of diagnosis and in management of the management of COPD within cough. And just to say that as well as this initial front sheet, which has got the CCG comparative data, the second sheet then goes on to compare the cough data at an individual practice level, so that there's actually that opportunity for peer comparison between practices as well. So next slide. And then this is the second slide of the COPD, one of the other pages of the COPD infographic. Next slide, please. So we've also done infographics on highlighting aspects in terms of physical health care for people with severe mental illness. So this is highlighting, shining a light on parity of esteem. So if you go to the next slide. So again, this was identifying aspects in terms of physical health measures for people with severe mental illness. So next slide. And more recently, we have produced this diabetes infographic. So, and that was pulling together data from the cough data as of March 2016, and also the most recently NDA data, which was published, I can't actually remember when it was published, January. So, and then we've produced this to pull all of that data into one-page infographic, so that CCGs can very clearly identify review this in terms of where they are in terms of performance around some of the key matrices nationally in relation to diabetes care. Next slide. So I think really in terms of a key thing around, I suppose, successful data visualization is that anyone seeing the design will find that this story is truthful, meaningful, useful and beautiful. So you actually capture people by the fact that you presented data in a way that makes them want to look at it. And also a story that could have been forgotten will now be remembered. So people will remember the data that's within that, which highlights things such as, you know, the number of people who are undiagnosed with diabetes or with atrial fibrillation within the CCG or individual practices. And next slide, please. So just to say, so that's actually my handwriting in the middle. It's not the best in the world, but actually it does look slightly better if you actually put it in a circle. So just finishing off by saying, you know, just saying that even simple things like that can, just drawing a circle around numbers actually can make the data stand out. So thank you. Any questions?
So that was fantastic, actually. I've just unmuted and shared my webcam, so I did forget to introduce myself at the start of this, and as Martin has eloquently put across in his presentation, a picture tells 1,000 words, so but you get better than what you get with my introducing myself. I've got probably, as you can see in the background, there's probably loads of infographics worth of files up there. I wish we could actually see so easily the contents of fantastic documents, as you've explained, as easily as this. Every time we're trying to get our message across to a commissioner or a you know, a group of a healthcare team trying to implement some of these new interventions. So yeah, there's just to get the ball rolling here, Martin. I mean, I thought it was a fantastic presentation, and these infographics are amazing. But I mean, apart from one of the questions that immediately arises, I suppose, is how much of, you know, clearly a lot of this data already exists and is sitting just, you know, buried in reports and you know, papers, etc. And really is it being ignored? So I guess a lot of this data already exists, but simply isn't being used to its best advantage.
Yeah, I mean, I'd just say that actually all of that data exists in some format in terms of being either available on the web or through reports. And actually the only data where we've actually had to do some additional analysis is in terms of when we've been looking at admissions. So we've had to get additional analysis around that, because that's something that we, you know, as a clinical network, we don't have easy access to. So, but, you know, everything else is out there. We haven't had to go and find data to utilize. Yeah.
No, I think it's excellent. So how long, if you like, I mean, probably everyone who's on the call has had to play around with PowerPoint at some time trying to make a nice slide to get a message across in a meeting. But these are, you know, a different level. So, I guess this requires professional, if you like, graphics trained, you know, people to put stuff like this together in a meaningful way. So, how much time does it take to put one of these together, and how many facilities around the country are there able to cope with this type of production for NHS purposes?
In terms of, I mean, I had started actually by doing stuff on PowerPoint, and then you know, struggling to do stuff on PowerPoint myself to try and present data.
Sounds familiar.
I have found that the best way that I do it now is, well, the important thing is to not go anywhere near any design's work until you've decided what story you want to tell with the data.
Mm-hmm.
And
so do you put this on a big piece of paper first, and then
yeah, and actually
I've got
to this stage now where I actually will sit down with a blank sheet of paper, the designer, and design it from scratch. And actually, so the diabetes infographic, in terms of the initial design and layout of it, was probably done in about 2 hours. Because actually I'm utilizing, I'm sitting with the designer who can do all the graphic stuff, and all I need to do is impart to them how I want it to. It doesn't mean that it's finished in 2 hours, but in terms of the initial broad design, it can be done in that time period. And the most crucial bit around this is actually, because each of those infographics that we've done them at an East Midlands level and at an individual CCG level. And the biggest difficulty is finding people who can transport the data into the infographic so that you can personalize them. And actually that's the crux, because when I did my first infographic, I was actually adding the data into every field myself. And
I think
time that took.
Yeah, I can imagine. There's a lot of questions on the line about people are obviously very keen to find out how they might be able to access this sort of graphic design capability, and does Martin offer help to present this data to other CCGs? Or can Heart UK, if you like, help by preventing something similar for CVD and cholesterol, etc. So I guess we've seen the potential for this approach to make the data so much more accessible. But how do you measure the impact of this, Martin? I mean, are you able to show where, if you like, a report has been presented and has been basically dismissed, and then it's been taken back with an infographic, and it's been sort of, hailed as being, groundbreaking and changing, whatever? Have you got any examples where it has actually changed a major decision by having the graphic there?
I can point to examples of where individual CCGs have, so all of the data around QOF, CCGs have had that available since, for years and years, and actually invariably don't really look at aspects in terms of performance. So I know that from the infographics that we presented around atrial fibrillation, that a large number of our CCGs prioritized work on atrial fibrillation on the basis of the graphics.
Yeah, no, I must say that the AF one is really very, very clear. I think that
the other ones, in terms of chronic kidney disease, that is invariably not on any CCG's priority lists. And actually we identified 8 CCGs who picked up work around, who previously prioritized work around chronic kidney disease, and the infographics, contributed to that because it pulled, all that data together in one place.
No, I think it's tremendous. I'll just. I'm
just going to say that actually I've recently, and I should have included it in this pack, that I've been working with the Kidney Federation in terms of developing an infographic business case for their National CKD Assist program.
Yeah, oh yes, the CKD Assist is,
So actually we've developed it's actually now, it started off as a 1-page business case. It's now a 2-page business case using infographics to be part of that.
Certainly, I think the ones that I'm very impressed with are the ones that focus on a particular issue, like the AF. I mean, I like the cardiovascular one that you showed with familial hypercholesterolaemia in the middle, which is a particular area of interest of mine. But in a sense, it's potential, I suppose, to lose something a little bit, if it was presented, in an infographic with a lot of things going on, like there are on that one. The AF one, to a certain extent, I think, is very powerful in that it does draw you in to see precisely what the impact of an intervention will be. And I think for the FH one, the same thing could potentially be done to show the impact of the intervention, as well as simply the frequency of it, in the population, which is all there was on that particular one.
Yeah.
But yeah, I think
what
the potential is there.
I just explained the cardiovascular prevention one. That was really around trying to highlight to CCGs that they can't just work on one area of cardiovascular disease.
Yeah.
They can't just work on it and think about it at all. That was to highlight the other areas within that they need to adopt a broad prevention strategy in terms of cardiovascular disease.
Yeah, so it is very much horses for courses, isn't it?
Yeah, it is.
Yeah, very good. So look, I think we are probably probably a good time to thank Martin for a fantastic presentation. I hope you can stay on the line because we're hoping to have a general question and answer involving everyone after Yusef's presentation. But I could possibly go on at this stage to introduce Yusef. So Yusef may not need much of an introduction actually, but